Hi, my name is Michelle Lewis. I am a licensed clinical social worker and I own Salt Lake Weight Counseling. My professional background is in substance abuse disorders, and I started working in a corporate wellness program with people struggling with weight management. I quickly realized that their relationship with food was much like the relationship I saw with addicts and their drug of choice. So I started using my skills and my background to help people through their relationship with food, and they experienced tremendous success. So I started this clinic and used my knowledge with my clients. So today in this video, I will teach you about binge eating and food addiction. We'll talk about how we form this relationship with food and how we treat it in our clinic. Okay, we are going to start with binge eating disorder criteria. Now, as we go through the criteria, you might notice that you fit some or all of these categories. This is just helpful to identify as we're going through this some of the differences between binge eating and food addiction. There is a lot of crossover, and this is just the diagnostic criteria. If you don't meet these, it doesn't mean that there isn't a binge eating issue. It just means that you might not meet the full criteria. So we see that you need 3 or more of the following: that you eat more rapidly than normal within a short period of time. So typically, 2 hours, you're eating maybe more than you would eat in the majority of the day. You eat until you're uncomfortably full. Now, show me an American who doesn't at one time or another eat until they're uncomfortably full. So we're looking at patterns here. Do you often eat until you're uncomfortably full? You eat large amounts of food when you're not physically hungry. You become embarrassed by your eating, so you hide it from other people. You eat alone. A lot of people will go from drive-through to drive-through, eating in their car, or buying things and just eating at home when no one's there. There's a sense of disgust or depression that comes with it. There's a sense of guilt that comes from overeating. So with food addiction, we see a history of yo-yo dieting. So with binge eating, we may not see a lot of dieting, just the continued pattern of eating. Historically, binge eating has not been affected by therapy when there's a food addiction issue. However, in our clinic, we have some very powerful techniques that have achieved great success with that, and we'll talk about that later on. There are foods that you can't live without in food addiction. So with binge eating, often what you'll see is that it might start out with those hyper palatable foods, the high fat, high sugar foods that come with food addiction, but the goal with binge eating is to totally escape, to numb out. So I have heard of people actually eating flour out of the container because that's all that was left in the house. And so, with food addiction, you're not going to see that. You're going to see them sticking to the high fat, high sugar foods. And it's really not necessarily about that getting to the point of uncomfortable fullness, but just feeling that high that comes from those foods. We see a tolerance. Tolerance means that you need more and more to get that same result. So maybe it took 1 cookie to make you get that feel-good feeling before, and now it takes 3. So over time, we build up a tolerance to that because of the dopamine release, which we'll talk about in a few minutes here. We see withdrawal. So withdrawal, when we talk about drugs, can be very profound. People die from seizures, sometimes with alcohol. With other drugs, they feel tremendously ill. They feel like they're going to die. With food, we don't necessarily see that, but in particular with sugar, after we get that crash, we might have a headache and feel irritable, lethargic, and that is our body actually going through withdrawal. And typically with food addiction treatment, there is a focus on abstinence, although in our clinic we don't subscribe to abstinence because in our experience, the more we tell someone not to eat something, the more that deprivation mentality kicks in, and that's when they end up binging. So we actually focus on more of an intuitive eating approach, which allows us to balance eating foods and not having that sense of deprivation. So you learn to eat in moderation, which when you're talking about food addiction initially with people, That seems like such a foreign concept that that's hard to relate to. But with our powerful therapy techniques, which we'll talk about, it actually is possible. Now we'll go back to the rest of the binge eating disorder criteria. There is a marked distress regarding binge eating. So it creates a lot of emotional distress when we're going through those patterns with food. Episodes occur at least once per week for 3 months. So again, these are the criteria for binge eating disorder. If it's less frequent than once per week, or it has been 1 or 2 months, you might not necessarily meet the criteria for binge eating disorder, but it doesn't mean that the binge eating doesn't need to be addressed. There's an absence of what we call compensatory behaviors. Compensatory behaviors would refer to purging, so vomiting, or excessive exercise. So those would be more bulimia criteria with the binge eating episodes rather than binge eating disorder. And then we have body image concerns. So with all of the eating going on, there is a sense of a struggle with how we feel about our bodies when we're dealing with binge eating disorder. So those are some of the differences between binge eating and food addiction. Now we'll talk about the similarities, where they cross over. So one, we see a diminished control over consumption. So we feel more and more out of control. We feel preoccupied with thoughts of food. Breakfast has just ended and we're already thinking about lunch. In addition, what we also see with this is that we become preoccupied with certain foods. So if I'm craving pizza, I might continue to obsess and think about pizza until I actually get it. We see continued use of food for emotional reasons despite consequences. We can see a lot of consequences come from this. Physical, obviously our health is impacted by this, our finances are impacted by this, not just because we're spending money on the food, but because of the health complications that come with that. I mean, particularly with insurance now, where more and more people are having to meet a deductible, that can be a lot of money. We also see relationship consequences in this relationship with food. Because just like other addictions, our primary relationship is with our drug of choice, whether that be cocaine or sugar. And when we become obsessed and preoccupied with that, it actually creates distance in our relationships. We see a diminished ability to reduce the quantity or frequency. So there's that tolerance piece that we talked about just a minute ago. So less and less control over that because it kind of takes on a life of its own. We see impulsivity. So we're unable to say no to things because parts of our brain that actually would keep us in check over time become diminished with the chemicals that are being released in our brain. We'll talk about that in just a minute too. And it's difficult for us to regulate our mood. We also see the same areas of the brain being activated by both binge eating and food addiction behavior. So we have this picture of the amygdala. The amygdala is the emotion center of the brain. So specifically, it is involved in emotional arousal, memory consolidation, and then what we see is a conditioning of the emotional response. So what that means is that if you learned early on in life that something was scary, you have the fear come up when you encounter that situation later on in life. So for example, if you were running out into the road when you were 3 years old and a parent grabbed you and was startled and upset, you're going to learn that cars are scary. And that is going to continue into the rest of your life as an adult, that you have that knee-jerk reaction when you step out onto a curb and a car almost hits you. In addition, this is where we see OCD, PTSD, and anxiety. So all of those uncomfortable fear emotions in this center. Also within this area, there is the hippocampus. So the hippocampus is where the olfactory bulb is stored. So the olfactory bulb is our sense of smell. So that might seem a little weird. Why are you talking about the sense of smell when we're talking about food? But what's really interesting about the sense of smell is that it is the easiest sense to pass through all of our barriers in our body. So it goes directly to our brain the quickest. So with that, we have memory in this area. Well, you might ask, what is the connection between the olfactory bulb and memory? Well, interestingly enough, our sense of smell is most closely tied to memory of all of our senses. So that's why you can smell something years, decades, even later than that, and automatically bring your brain back to some event, pleasant and unpleasant. And then we have emotions based on those memories in this hippocampus area. So even just recalling some sort of painful event evokes those same memories. Dopamine has a lot of functions. So first, it is that desire and pleasure that we talked about. So that pleasure center in our brain releases that dopamine. It's our feel-good chemical. We also see attachment and love. So I make the joke when someone says, I love cupcakes or pizza or whatever it is, they honestly might love those food items because we form a false sense of attachment and connection. It becomes a friend, and that bond strengthens over time because food never lets us down like people can. We see an integration of thoughts and feelings, so our thoughts and feelings coming together to mesh. And it's also really intricately tied into our mood. So one of the things that we see with deficiencies, we see what we call anhedonia. So anhedonia is a lack of pleasure in things. With that, a lack of dopamine, what we'll do is we will actively seek out things that will increase the dopamine so that we can start to feel normal. We see a lack of focus, some distractibility, a lack of sense of connection with other people, difficulty forming relationships, and we also see a lack of remorse about actions. So things that normally we would feel guilty about doing, we will do to get that fix, to get that dopamine release. Now later we'll probably feel badly about it, but in the moment we will do anything to get that fix. We're going to talk about the Yale milkshake study. So in this study, they took groups of women who struggle with overeating and gave them a picture of a chocolate milkshake and took a brain scan. So the brain scan was showing areas of the brain that are active. Based on our discussion so far, what do you think happened? Well, those reward centers, they lit up. They were very bright, and so it was based on color, which I'll show you the scan in just a minute here. So those reward centers lit up. Well, then they gave them a chocolate milkshake and took a brain scan. What do you think happened? You're probably thinking it lit up, and you're right. But you're probably thinking that it lit up more than when they saw the picture, and you would be wrong. It's kind of tricky because what happened is that the initial surge of dopamine actually activated the brain more than getting the chocolate milkshake. And I think probably a couple things happened here. One, that initial surge of dopamine may have depleted the stores, and so when they actually got the chocolate milkshake, it wasn't, as active. Two, one of the things that we see with addiction is that the anticipation actually creates more of a reward in the brain than getting the substance, because often what happens by the time you get it, you're like on to the next thing. You've scratched the itch and you're done with it already. But the third piece might be that for most people who have this relationship with food, they have already shamed themselves, and so it's no longer even desirable. So I'll throw up these brain scans for you, and I want you to just notice the colors. So the normal brain scan and the sugar cocaine brain scans, they're a little bit different, so don't let the blue of the brain fool you. But looking at just those center areas of the brain, those are our reward centers. And what you'll notice is that the normal brain, or the non-addicted brain, has red in the middle. Red actually indicates the most activity. So that brain is more active than either of the addictive brains. And we'll talk about why that is in just a second. So as we're looking at this, we see that even though the addict we would think that the addict's brains are much more active, it's actually a non-addicted brain that is able to feel things more fully. So can you have too much dopamine? Yes. The answer to that statement is yes. So one of the things that they've seen in research in rat studies, not that I advocate rat studies, but when rats are given what we call hyperpalatable foods, so high fat, high sugar foods, over time they develop this sense of addiction with these dopamine releases, and they go through withdrawals. So part of that, we also see a flooding of that dopamine actually damaging our dopamine receptors, so it washes them out. And then we start to see an insatiable hunger, a feeling of deprivation. So, and that feeling of deprivation increases the surges of the insatiable hunger. Interestingly enough, we also see less activity in the prefrontal cortex. So as we talked about earlier, that prefrontal cortex is going to tell us that we don't need something. So it's going to inhibit us from doing things. So with less activity in that prefrontal cortex, we are more susceptible to being impulsive. So one of the things that we do see, though, the good news is that we can actually rebuild some of those receptors. So where we have the flooding and less activity in our brain in that area, we can eventually start to rebuild and heal those parts. So speaking of trauma and PTSD, there was actually a study that came out last year that looked at PTSD and food addiction. They recognized that women who have PTSD are twice as likely to experience food addiction. And I actually thought that was shockingly low. I think that a tremendous number of people, particularly women who experience trauma, specifically sexual trauma, do end up struggling with food, with binge eating and or food addiction. One of the things that they did see is that the more symptoms of PTSD you have, so you may not even meet the full criteria, they were looking at people who specifically meet the full criteria, but the more symptoms of PTSD you have, the more symptoms of food addiction you have, or the more strongly those are correlated. Interestingly enough, one of the things that they see is that in eating disorder treatment and residential eating disorder treatment, 74% of the women do have a history of trauma. So obviously you can see a huge connection there. Now, when we talk about trauma occurs on a spectrum. So certainly we look at abuse and war as trauma. Those are what we call the big T traumas, but it occurs on a spectrum. So trauma could be getting teased on the playground once when you were in second grade. It all has to do with whether or not we continue to have emotional distress, and if it stays with us, if it's just unprocessed. So what can happen with that experience in second grade, if someone called you ugly in second grade and you eventually started calling yourself ugly, it may be tied to that even if you don't realize that. Because what we see is that it changes the structure of our brain. So those difficult emotional experiences actually make changes in our brain. So a few of the other things that we see with trauma and food is that food deprivation early on in life has a huge impact on our relationship with food. I can't even tell you how immense it is. So one of the things that we see is that if people grew up in poverty and there wasn't enough food to go around, or if they had a big family and you had to get it really quickly because then there just wasn't much left, that can have a huge impact on our relationship with food later on in life. Also likely that if you struggled with your weight early on in life and someone put you on a diet, that has a huge piece in deprivation. So we talked about those emotion centers in our brain, that primitive part of our brain that gets activated, particularly with a biological need like food, and it will stay activated until we, are able to work through that trauma. We also see a phenomenon, we refer to as body armor. So when there is, in particular, sexual trauma, sometimes physical abuse, but definitely sexual trauma, we gain weight to protect ourselves, to insulate ourselves, and try and prevent ourselves from getting victimized in the future. So there are a lot of fears around losing weight that are tied into overeating. A lot of the time with clients, I will see that as soon as they start to make changes in their weight, they will start binge eating again, because that fear of being re-victimized, it comes up and they feel the need to protect themselves. And then lastly, we have this relationship with food because of a sense of control. If we had chaotic childhoods, food may be one of the only things that we were able to control during that time period. What we also see too, just incidentally, not trauma related, it can have a trauma impact, is that extreme dieting, that yo-yo diet over and over again, can trigger that deprivation in our brain. So it might not just be childhood, but just even over our adulthood, that food deprivation. Because one of the things that they saw in a study on this, in 1944, they took healthy men, and put them on a very low calorie diet, so half of what their calorie needs were. And what they saw is that a lot of those men developed binge eating disorder behavior. So once they were able to eat, that had triggered, it kind of flipped a switch in their brain, and they had started to binge eat. So we are going to talk about the window of tolerance. Dan Siegel is a psychologist who developed this theory, and I think it's very helpful. But we all have a window of tolerance. So the window of tolerance is our ability to sit in uncomfortable emotions and be able to deal with them effectively. So one of the things that we see is that when we have a trauma history, our window of tolerance gets very, very small. And through counseling, we can widen that window of tolerance. So things that we previously weren't able to cope with, we're able to cope with after gaining some skills. So what happens when we're outside of that window of tolerance, so anything that creates those uncomfortable emotions will throw us into one of two places, either hyperarousal, so our overstimulated state where we're in the fight or flight mentality, so that adrenaline response, or hypoarousal, which means our system shuts down and we end up in the freeze or dissociate state. So, and people are different in how they, which state they tend to go into, but one of the things that we find is that when we have trauma early on in life, or continued trauma throughout our life, we find that fighting or fleeing is not possible, so we shut down. It's kind of like a cat who's chasing a mouse. Initially, the mouse will run, but when it realizes that the cat is going to get it, it plays dead. So that freeze piece is really powerful. Well, when it comes to dissociation is actually kind of the psychological form of shock. So when someone gets into a car accident, let's say, and they're injured pretty badly, they might go into shock where their brain actually separates from their body to preserve, themselves from feeling that pain. We do the same thing emotionally. It's called dissociation. So dissociation, again, occurs on a spectrum too. So all of these things kind of occur on a spectrum. With dissociation on the extreme spectrum, we see multiple personalities. We don't call it multiple personalities anymore, but it's dissociative identity disorder, where we have separate and distinct personalities. That's a phenomenon that comes from our need to survive childhood trauma. Extreme childhood trauma will develop those personalities. But dissociation on the mild form of that spectrum could be checking out when you're driving on the freeway. So how often have you driven to work without even thinking about it? That's dissociation. And so there are a lot of things in between. Binge eating and food addiction are forms of dissociation. It's a way of us checking out emotionally from what's going on physically. So as we're going through the treatment process, we're allowing ourselves to integrate more fully by widening that window of tolerance so we don't have to check out any longer. So what do you do? So obviously we do counseling. It's all like weight counseling. We're all licensed therapists and we use some very powerful specialized techniques. One is cognitive behavioral therapy. So cognitive CBT is cognitive behavioral therapy that allows us to look at how our thoughts impact our emotions and our behavior. We have so much self-talk that comes with all of this. You know, there's often this cycle of self-sabotage that is largely due to the negative beliefs that we have about ourselves. DBT stands for dialectical behavior therapy. There are some skills that are really helpful, particularly with mindfulness. With eating, it's a way of escaping, it's a way of getting out of what's going on. But mindfulness helps bring us back to the present and allow us to stay in that window of tolerance. We also use a technique called internal family systems, which isn't family therapy. It's a way of looking at all of the pieces of ourselves and the role and function that they have. And instead of fighting against them, actually starting to appreciate what they have done for us over our lives, because at one point they were a survival mechanism, even if they were misguided. And by just even acknowledging them and trying to understand why these behaviors have come to be, it can reduce the intensity behind them. And then lastly, we use EMDR. EMDR stands for eye movement desensitization and reprocessing. It's a very powerful trauma therapy. It allows us to process through information that's been stuck, kind of frozen in our brains, that continues to create distress. So we can take an incredibly distressing event and then you no longer feel anything about it. It's not a frontal lobotomy. We're not taking it away. We're not wiping your memory clean, but it just allows you to, think about what has happened and it just doesn't feel as intense. We just don't have those emotions, those negative emotions around it anymore. We also use EMDR to target the emotional connection to food, to target the positive aspects that come from food, that escape, that sense of relief, soothing, comfort, or even defiance that we get met through food. So it's amazing. Nutrition therapy. So, going back to what I was saying earlier about the food deprivation, by making sure that you have enough food and that you're eating adequately, it can help calm some of this down. So not doing those extreme diets, not putting your calorie consumption so low that you're obsessing about food, and making sure that you have enough to eat can really help diminish some of the binge eating. Medication. We don't actually offer medication in our clinic, but we do have really great professionals that we can refer you to for medication management that can help with the symptoms of binge eating and food addiction. And then group support. We do offer a free support group for the clients we have engaged in individual therapy. It is once a month. It's an amazing group of people, and we talk about skills to help improve our ability to cope and just talk about the process, because so many people feel alone in this. And there are some 12-step groups that are offered that can help with food addiction and binge eating. You do have to be a little bit careful with the 12-step groups, because some of the groups advise abstinence from white flour, white sugar kinds of things, and that can actually look more like a diet, which then drives you further into the binge eating process. But these are the services that we do have available. If you have any questions about what this would look like, please don't hesitate to give us a call at 801-907-1391, 801-907-1391, or you can email us at office@slweightcounseling.com. We are on a few different insurance panels: Blue Cross, DMBA, and EMI. If you'd like more information about the cost of our services, please don't hesitate to reach out. Thank you so much for joining us today. Have a great day. Bye-bye.